Bismillah, Alhamdulillah, Salatu Wassalam ala Rasulullah. Inshallah, today our lecture in Pharmacy Practice course, responding to symptoms, we will discuss women health, and one of these symptoms related to women health is dysmenorrhea. Dysmenorrhea, or painful menstruation, it has been estimated that as many as 1 in 2 women suffer from dysmenorrhea, here period pains. That is mean about 50% of the women will suffer from dysmenorrhea. Pharmacists should remain aware that discussing menstrual problems is potentially embarrassing for the patient and should therefore try to create an atmosphere of privacy. What you need to know as a community pharmacist to respond well to a customer that suffer from dysmenorrhea, you should know the age and the previous history, regularity and timing of the cycle, timing and nature of the pains, relationship with menstruation, other symptoms such as headache, backache, nausea, vomiting, constipation, faintness, dizziness, fatigue, and the premenstrual syndrome, PMS, and the medication that the customer or the patient already used. Regarding the age, the big incidence of primary dysmenorrhea occur in women between the age of 17 and 25 years of age. Mainly the primary dysmenorrhea is a painful menstruation that occur uh, just before or during menstruation when there is an absence of pathological condition. Whereas secondary dysmenorrhea, there is an underlying if underlying causative pathological disorder or condition that result in secondary dysmenorrhea. The primary dysmenorrhea is defined as a pain in the absence of pelvic disease, whereas secondary dysmenorrhea refers to pain which may be due to underlying disease. Secondary dysmenorrhea is most common in women that age over 30 years of age and is rare in women that ages under 25 years of age. Common causes include these common causes of the secondary dysmenorrhea and endometriosis, the proliferation of the endometria, the proliferation that occur in other part other than the uterus, such as the fallopian tube or the ovaries. This is proliferation here we'll call endometriosis and associated with a pain, or pelvic inflammatory disease or pelvic infections that occur in the pelvic. Primary dysmenorrhea is uncommon after having the children. Regarding the previous history, we find that dysmenorrhea is often not associated with the start of menstruation. This is because during the early months or sometimes years of menstruation, ovulation does not occur. The pharmacist should establish whether the menstrual cycle is regular and the length of the cycle. Further questioning should then focus on the timing of the pain in relation to menstruation, because the premenstrual syndrome and the primary dysmenorrhea usually have a relation with the menstruation just before or at the beginning of menstruation is okay. Timing and nature of the pain. Also, you should know the timing and the nature of the pain. Primary dysmenorrhea classically present as a cramping, colic, lower abdominal pain that often begins during the day just before bleeding start. The pain gradually eases after the start of menstruation and is often gone by the end of the first day of bleeding. The pain of secondary or acquired dysmenorrhea, there is a differential here. This can help in differential diagnosis between primary and the secondary dysmenorrhea. The pain in secondary or acquired dysmenorrhea may occur during other part of menstrual cycle and can be relieved or worsened by menstruation. Such pain is often described as dull, aging pain rather than being spasmodic or cramping in nature. The spasmodic or cramping pain indicate primary dysmenorrhea rather than secondary dysmenorrhea, which develop from uh, pathological such as a pelvic infection or inflammation or endometriosis or other predisposing pathological condition. Secondary dysmenorrhea is more common in older women, especially in those who have had children. If from questioning the pharmacist suspects secondary dysmenorrhea, the patient should be referred to her doctor for further investigation. Even here, regarding these symptoms, we only respond for primary dysmenorrhea. Secondary dysmenorrhea is an indication for referral. Pelvic infection can occur and may be acute or chronic in nature. It is important to know whether an intrauterine contraceptive device, IUDs, here usually in a form of coil, is used because the coil can cause increased discomfort and heavier periods, but also may predispose to infection, and this can result in secondary dysmenorrhea. The other symptoms, women who experience dysmenorrhea will often describe other symptoms. These include nausea, vomiting, general anxiety, discomfort, constipation, headache, backache, fatigue, feeling faint, and dizziness. We have a premenstrual syndrome. The term PMS, premenstrual syndrome, describes a collection of symptoms, both physical and mental, whose incidence is related to the menstrual cycle. Premenstrual syndrome هم related to onset of the menstrual cycle, just occur pre، عشان كده مسميناهم premenstrual syndrome. Symptoms are experienced cyclically, usually from 2 to 14 days before the start of menstruation, so it's called premenstrual syndrome. Relief from symptoms generally occur once menstrual bleeding begins. Once the bleeding of menstruation starts, then the patient will be free of the symptoms of premenstrual syndrome. Sufferers often complain of bloated abdomen, increase in weight, swelling of the ankles and fingers, breast tenderness, and headaches. Besides the mental symptoms, which include any or all of irritability, tension, depression, difficulty in concentrating, and tiredness. Treatments of the symptoms of PMS is a matter of debate, and there is a high placebo response to therapy of mood changes, breast discomfort, and headache when taken from 2 weeks before the period starts or throughout the cycle. Even the premenstrual, so that the premenstrual syndrome here debate, okay, debate because placebo response is high and very effective. Placebo, if there is a placebo, no medication. So this high placebo response in premenstrual syndrome, uh, especially when taken 2 weeks before a period starts, is a matter of debate. There is some evidence that pyridoxine, vitamin B6, may reduce symptoms. You should know that higher doses of pyridoxine are reported to have led to neuritis, especially peripheral neuritis. The medication for dysmenorrhea and premenstrual syndrome, the pain of dysmenorrhea is thought to be linked to increased prostaglandin activity, especially the spasmogenic prostaglandin, such as prostaglandin F2 alpha, so that the women which have higher levels of spasmogenic prostaglandins are usually suffer from dysmenorrhea. Increased prostaglandin activity and raised prostaglandin levels have been found in the menstrual fluids and circulating blood of the women who suffer from dysmenorrhea. Therefore, the use of analgesics that inhibit the synthesis of prostaglandin is logical, so that the primary treatment of dysmenorrhea is the analgesic because they inhibit the prostaglandin synthesis through its action on cyclooxygenase COX enzyme. It's important, however, for the pharmacist to make sure that the patient is not already taking an non-steroid anti-inflammatory drug. Women who are taking oral contraceptive combines or progestin-only pills usually find that the symptoms of dysmenorrhea are reduced or eliminated altogether. And so any woman presenting to your community pharmacist with the symptoms of dysmenorrhea, although they are taking contraceptive pills, it's probably best referred to the doctor for further investigation. When to refer? First, if there is the presence of the abnormal vaginal discharge, presence of abnormal bleeding, symptoms suggest secondary dysmenorrhea, is indication of referral. If there is a severe intermenstrual pain, mills such as mills smells pain, and this is called also the ovulation pain, and bleeding. Just this type of pain occur at the middle of the cycle because due to the ovulation. If there is a failure of medication, if there is a pain with late period because this can because there is a possibility of an ectopic pregnancy outside the uterus, ectopic pregnancy. If there is a presence of fever with the symptoms also indicate referral. Treatment time scale. If the pain of the primary dysmenorrhea is not improved after 2 cycles of treatments, referral to the doctor would be advisable. The management, we have the drug of choice are the analgesics. Simple explanation about why period pains occur together with sympathy or reassurance is important for the patient regarding the counseling of the patient. Treatment with simple analgesics is often very effective in dysmenorrhea. Ibuprofen can be considered the drug of choice for dysmenorrhea, providing the drug is appropriate for the patient. That is mean the pharmacist has questioned the patient about previous use of aspirin and history of GIT problems and asthma. If there is no contraindication to the use of ibuprofen, then the ibuprofen is the drug of choice for treatment of dysmenorrhea. We have aspirin, but aspirin can cause GIT upsets and is more irritant to the stomach than ibuprofen. For those who experience symptoms of nausea and vomiting with dysmenorrhea, aspirin is probably best avoided. Patients patients should be advised to take aspirin with or after meals to minimize the GIT irritation that caused by aspirin. The pharmacist should establish whether the patient has any history of aspirin sensitivity before recommending the drug, especially that the patient who's aspirin sensitive asthmatic patient should be not use aspirin for this reason. We have paracetamol is a useful treatment when the patient cannot take ibuprofen or aspirin because of the stomach problems or potential sensitivity. Paracetamol is also useful when the patient is suffering with nausea and vomiting as well as pain, since it does not irritate the stomach. We have hyoscine also, which is an anticholinergic, smooth muscle relaxant. Is included in one priority product marketed for the treatment of dysmenorrhea on the theoretical basis that the antispasmodic action will reduce cramping. The anticholinergic effects of hyoscine means it is contraindicated in women with close angle glaucoma and best avoided in any other drug with anticholinergic effects such as tricyclic antidepressant and antihistamine and other drugs that having anti-muscarinic effects. We have the caffeine. There is some evidence for this from this evidence is from trial combined ibuprofen and caffeine with ibuprofen alone and caffeine alone, that caffeine may enhance the analgesic effect of ibuprofen and also enhance the analgesic effect of paracetamol. So OTC products containing usually containing 15 to 65 milligram of caffeine per tablet. A similar effect could be achieved through drinking tea, coffee, or cola. A cup of instant coffee usually contains about 80 milligrams of caffeine, while a cup of freshly brewed coffee about 130 milligrams of caffeine, and a cup of tea contains usually 50 milligrams of caffeine, and a can of cola drink contain about 40 to 60 milligrams of caffeine. We have a practical point for the patient or a customer that suffer from dysmenorrhea or premenstrual syndrome. Uh, Exercise during menstruation is not harmful. There is some evidence that moderate aerobic exercise can improve symptoms of premenstrual syndrome. Also, there is some evidence that a low-fat, high-carbohydrate diet reduces breast pain and tenderness that occur during dysmenorrhea and premenstrual syndrome. So, as a community pharmacist, you should give the following advice to women taking analgesic for dysmenorrhea. This first, take the first dose as soon as your pain begins or as soon as the bleeding starts, whichever comes first. The first whatever the pain first before menstrual before bleeding, or the bleeding is before the pain, whatever which is the first, you should take as soon as the analgesic drug. Take the tablet regularly for 2 to 3 days each period, rather than now and then when the pain builds up. You should take the medication regularly after the start of the symptoms, pain or bleeding, whichever the first, and take it regularly, not when there is attack of a pain. If your pain are not eased, ask the doctor or the pharmacist whether the dose that you are taking is the maximal allowed. Side effects are uncommon with analgesics that used for the treatment of dysmenorrhea and premenstrual syndrome if they are taken analgesic just for few days at a time during each period, because there is no chronic use of this. Last, we have a case. Jenny is a young woman aged about 18 years who looks rather embarrassed and asks you what would be the best thing for her period pains. After questioning, Jenny tells you that she started her period about 5 years ago and has never had any problem with period pains until recently. Her periods are regular every 4 weeks. They have not become heavier, but she now gets pain. Which start this pain starts a few hours before her period. It's clear this is an premenstrual syndrome, or this primary dysmenorrhea. The pain has usually gone by the end of the first day of menstruation. Also, this is another indicator for uh, primary dysmenorrhea. And Jenny has never had any pain during other parts of the cycle. So also this we in this part will exclude secondary dysmenorrhea, because secondary dysmenorrhea occur as other part of menstrual cycle. She says she has not tried any medicine yet, is not taking any medicine from the doctor, and that she can normally take aspirin without any problems. What is your recommendation? To answer this, from the result of questioning, it sounds as so Jenny is suffering from straightforward primary dysmenorrhea. So that's your recommendation. She should be advised to take ibuprofen 200 milligram to 400 milligram 3 times daily. She could be recommended to follow this regimen for 2 months, this cycle and the next cycle, and invited back to see if the treatment has worked. Otherwise, not worked, you should repair her. I think that is all. Thank you for listening. Assalamu alaikum wa rahmatullah wa barakatuh.